Hello everyone, my name is Sharayu Gavande. Today we will talk about estrogen. So the subtopics I will cover under this is estrogen, preparation and dose, adverse effects, uses, anti-estrogen, selective estrogen receptor downregulator, selective estrogen receptor modulators. So estrogen. Estrogen is a female sex hormone produced by the ovary. Estradiol is the major estrogen synthesized by Graafian follicle, corpus luteum and placenta. So in our body there are two estrogen receptor alpha and beta. So estrogen receptor alpha is present on uterus, vagina, ovary, breast, blood vessel and hypothalamus, whereas estrogen receptor beta is present on prostate and ovaries. So we will talk about the classification of estrogen and related drugs. So under estrogen, estrogens are natural and synthetic. Natural, estradiol, estrone, estriol, and synthetic are ethinyl estradiol, mistranol, tibolonol. Now anti-estrogen is clomiphene citrate. Selective estrogen receptor downregulator is fulvestrant, and selective estrogen receptor modulator is tamoxifen citrate, tormifen, raloxifene. Aromatase inhibitor is letrozole, anastrozole. So we will talk about the regulation of estrogen. So our hypothalamus releases gonadotropin releasing hormone, which will stimulate anterior pituitary to release FSH and LH. This FSH and LH will stimulate ovary. The FSH will stimulate Graafian follicle to release estrogen, and LH will stimulate corpus luteum to release progesterone. Whenever the level of the estrogen or progesterone will rise, it will give the negative feedback inhibition on anterior pituitary as well as hypothalamus. Now preparation and doses. The preferred route of administration of estrogen is oral, but whenever we have to give the large doses of estrogen, then we have to administer it intramuscularly. Now the preparations are estradiol benzoate, cypionate, enanthanate, valerate 2.5 to 10 mg intramuscular. Conjugated estrogen 0.625 to 1.25 mg per day oral. Ethinyl estradiol for menopausal syndrome 0.02 to 0.2 mg per day oral. As like mistranol, estriol succinate, phosphostrol, tetrasodium, etc. Now adverse effects of estrogen. It will suppress libido. Gynecomastia causes gynecomastia and feminization when given to the male. Estrogen when given causes fusion of the epiphysis, thus reduce the growth in children. It is in menopausal women, estrogen increases the risk of irregular bleeding and endometrial carcinoma. Estrogen can also accelerate the growth of existing breast cancer carcinoma, but at a low doses does not develop new breast cancer. On long-term estrogen therapy, it doubles the incidence of gallstone, causes benign hepatoma, and also worsen the conditions of migraine, epilepsy, endometriosis. Now uses of estrogen. First of all, we will use it as an oral contraceptive. Estrogen in combination with progesterone is used as an oral contraceptive. Secondly, we can use it in a postmenopausal hormonal replacement therapy. In hormonal replacement therapy, it produces symptoms like a disturbed sleep, genital atrophy, osteoporosis leading to fracture, increases in cardiovascular diseases. Estrogen here relieve the symptoms like hot flashes, night sweat, depression, sleeplessness. Estrogen also inhibits the osteoclast activity, thereby preventing the osteoporosis. It is also used in senile vaginitis. Estrogen helps to treat the atropic vaginitis. It is also used in dysmenorrhea and also used in a carcinoma of prostate. Here estrogen inhibits the androgen production, thus produce the relief. Now we will talk about the anti-estrogen. So under the anti-estrogen, the drug we will learn is clomiphene citrate. Now it is competitively block the estrogen receptor alpha and beta in the anterior pituitary. So whenever the estrogen will be increased, the level of estrogen increased, it will not act on this estrogen receptor because of the blockade of this receptor. Because of this, estrogen will not be inhibited. So it will cause to the inhibition of the feedback inhibition. So there will be increased release of the FSH and LH. Thus, it will also induces ovulation. So, what are the uses of this drug? It can be used in infertility. It will use to treat infertility due to an ovulation, and it should not be given for more than 6 cycles because it can lead to increased risk of the ovarian cancer. So, it should be given on the second day of the menstrual cycle, 50 mg once a day for 5 days. It can be also used in a male infertility, used to increase the sperm count and testosterone secretion. So the adverse effect of this drug is hot flushes, nausea, vomiting, headache, loss of hair, hyperstimulation syndrome, multiple pregnancy and weight gain. So let us talk about selective estrogen receptor downregulator. In this, there will be the suppression of the estrogen release, or it will also act as an antagonist of estrogen. So the drug under this heading comes is fulvestrant. It is the pure estrogen antagonist. It is used in treatment of tamoxifen resistant breast cancer. This term we will learn in the next slide. So the action of the fulvestrant is it will inhibit the estrogen receptor dimerization. So there will be the interaction between the estrogen receptor and DNA will be prevented. This will lead to the degradation of the receptor. Thus, in short, it will act as an antagonist of estrogen. So the dose is 250 to 500 mg intramuscular injection in buttock monthly. Now we will learn about a selective estrogen receptor modulator. In this, the drug will act as both agonist and antagonist. Okay, this will act in a selective manner. So drugs come under it are tamoxifen citrate, raloxifene and toremifene. So first we will learn about tamoxifen citrate. So tamoxifen citrate has a agonist action on uterus, on bone, liver and pituitary. It has an antagonist action on breast carcinoma, blood vessel, peripheral sites. So what are the actions of tamoxifen? It will increase the bone density. It will stimulate the endometrial proliferation in the postmenopausal woman. It will decrease in the total and LDL cholesterol without any change in the level of the HDL. It will inhibit the human breast carcinoma cell and hot flashes. So what are the adverse effects of this drug? It causes nausea, vomiting, increase in risk of the endometrial cancer, venous thrombosis, vaginal bleeding. So dose is 20 to 40 mg per day. Now second drug is raloxifene. So raloxifene has an agonist action on the bone, lipid metabolism, cardiovascular system and has antagonistic action on endometrium and breast. It has the high affinity for the estrogen receptor. So what are the actions of this drug? It will prevent the bone loss in the postmenopausal woman. It will also reduce the LDL cholesterol level without any change in the HDL, same as that of the taloxifene. It does not stimulate the endometrial proliferation and no increase in the risk of endometrial cancer. Uses are, it is used in the treatment of osteoporosis in postmenopausal women. So now we will discuss some MCQs. So first question is, the primary indication of tamoxifen citrate is. So tamoxifen citrate is used in the treatment of the carcinoma of the breast. So what are the options? Option A is female fertility, no. B is carcinoma of a breast, yes. C is the endometrial carcinoma. D is the endometriosis. So second question is, what is the metabolic effect of estrogen? So estrogen will cause reduce in the LDL cholesterol and the HDL cholesterol level will remain as it is. So first option is reduced HDL cholesterol, wrong. Reduce LDL cholesterol, yes. Salt and water loss, no. Hypoglycemia, no. Now third question is, postmenopausal osteoporosis is treated with. So its answer is raloxifene. So first A is our answer. Now fourth question is, estrogen therapy was worsen all of the following condition except. It can worsen migraine, cholestasis, endometriosis, but the B option acne is not an